Hello viewers, and welcome to this tutorial video from the California Department of Public Health. Today I'm going to show you how to use a tool on our website to look up information on any hospital or nursing home in the state of California. So let's get started. First step is to open your internet browser, and we're going to go to our home page, which is cdph.ca.gov. And you see our home page here, and above there's a picture of our governor, and above his head you see a row of green tabs. We're going to go to the fourth tab, which is Health Information, and click on it. Pulls up two columns of hyperlinks, and we're going to go to the Health Facilities Consumer Information System. And why don't we go ahead and bookmark this page so that we remember it. And once you have that, this will be the page that you go to if you want to look up any nursing home in the state or any hospital throughout the state. The first step is to go scroll down here a little bit to click here to find a facility. And let's go ahead and do a nursing home first. So we have what's commonly called a nursing home is known here as a skilled nursing facility. So click search or the word skilled nursing facility, and it puts a check mark in this little box. And scroll down. You can enter information down here. So if you're looking for one in your zip code, you can type in your zip code here, or your city, or just your county. Or if you know the name of the facility, you can type it in here, or just maybe a couple keywords in the name. I'm going to go ahead and click search to show us all the nursing homes in the state of California. So there we are. There are 1,274 facilities. I'm just going to pick one at random to show you the page. There we go. So it pulls up a map, and below that is some contact information, then the licensee and the total bed capacity, and then down below that we have complaints, facility self-reported incidents, inspection results, and I want to talk a little bit about some of these things, but first I want to show you a couple of other links. So this is one tool that's available on the internet. Another one is the federal tool, which is from Medicare.gov, and that's Nursing Home Compare. And we recommend that someone doing research on a nursing home look at all the tools that are available, including our tool and the federal tool, and make their own evaluation, because they all do things slightly differently. There are also advocate groups in California that have their own search tools, and all of these things are important ways to consider and make your own judgment as far as evaluating a nursing home. Also, I want to point out underneath this subtitle we have view statements of deficiencies with plan of corrections. So the records I'm going to show you a preview of down here are actually, for the last couple of years, we've been posting all the records for each facility on this website. This is required by the Federal Affordable Cares Act. So you can actually read the findings from surveys at this facility by pulling up these PDFs. So I'm going to click the back button, and we'll go back to the complaints. So complaints can come from any number of places. They can come from patients, from patient families or friends, from employees that work at the facility. And we receive a complaint, we take the information, we do not release the information on who complained to the facility. We keep the person's name anonymous, and let's go ahead and click on complaints. And this will pull up all the complaints we have that have a completed investigation in our system. So a complaint can either result in, we can either have findings or we could have no findings. If there are no findings and it was unsubstantiated, then that is listed here. But if we found something and it was substantiated, then those findings may lead to a report for this particular facility. And to track down a copy of that report, you can ask the facility for it. They're required to keep it on site, and you can use this intake number. You can also request it from our district office or go to our district office and view it. To find our district offices, go up here, you'll see this quick links up here on every page, and the district offices are listed on a district office page along with their phone number and address. There are 14 across the state. Okay, we'll go back to the page where we were. So there's complaints. We'll go back again. And underneath complaints we have self-reported incidents. Self-reported incidents are similar to complaints. They can be for the same kinds of things, but this just means that the facility itself reported the incident instead of someone at the facility. And again, we go in, we make an initial assessment. They may be substantiated, they may be unsubstantiated, and there is an investigation number, and these also have a record that you can view. And if you are a consumer who is interested in filing a complaint, you can also do that on this page. You'll see the hyperlink here again in the quick links column. Third from the bottom is consumer complaints. And you would just fill out this information here and submit it, and after you filled it out, and then it would be routed to our district office, and then they would get in touch with you and initiate their investigation. Okay, so that's the most important things about this facility. I'm going to click, let's go back up to the green tabs and kind of start again at the Health Facilities Consumer Information System, and this time we're going to pull up a hospital. So we again go down here to click here to find a facility. Underneath the long-term care facilities, we scroll under that and we'll find the hospitals. Click on General Acute Care Hospital. It puts a check mark in the box, and let's just pull up all the hospitals in California. You see 436. We're going to pick a number and then just click on a facility at random. And you'll see this looks very similar to the information we have on nursing homes. There's the contact number. There's which district office is in charge of this facility. It's listed right here. There's the licensee and then bed capacity, the services offered at this facility. I picked one that has a lot of services. And then you'll also see complaints, self-reported incidents, state enforcement actions. So very similar for both nursing homes and hospitals. So there you go. I think that gives you a good brief tutorial about this system and its uses. So I hope you found that helpful, and that concludes the tutorial for today. Thank you much for viewing.